everyone, I am Dr. RAIZA HAMEED, Specialist Pulmonologist in Aster Jubilee Medical Complex, Bur Dubai. So August 1st is coming and it is observed as World Lung Cancer Day. And today I am here to reach out to public to give a little awareness about lung cancer. So why is it important to talk about lung cancer? Lung cancer is the third most common cause of death in the world, and it is the most common killer cancer in the world also. Hence, it's important to have an idea about lung cancer and who are the people who are prone for lung cancer. So first of all, let's see what are the risk factors of lung cancer. The number one risk factor of lung cancer is smoking. I cannot emphasize more on smoking as a risk factor of lung cancer because 80% of lung cancer is caused by smoking, and it includes all types of smoking including cigarettes, BDs, vaping, e-cigarettes, everything. And the rest 20% of lung cancer is seen in non-smokers, which are caused by various environmental and genetical factors like genes which are promoting lung cancer inside your body, family history of lung cancer, then environmental factors like exposure to radiation, asbestos exposure or chemicals. So what are the symptoms of lung cancer? So one unfortunate thing about lung cancer is lung cancer present very late with symptoms in the course of disease. Until you reach a stage 3 or stage 4 of lung cancer, 75 to 80% patients doesn't have any symptoms. And when symptoms arise, the most common symptoms are prolonged coughing, blood in the cough, hemoptysis, chest pain, dull aching type of chest pain, breathlessness, weight loss, new onset wheezing, etc. So this is a challenge. The late development of symptoms is a challenge in detection of lung cancer, and we suggest screening for lung cancer to overcome this. So screening means you screen for patients who are prone to develop lung cancer with certain tests so that we can detect development of lung cancer at an earlier stage. So screening method suggested is low dose of CT scan of thorax. It is low dose of radiation, so there is not much harm with radiation exposure. So we can ask people who are prone for development of lung cancer to get a screening test once in a year or once in 2 years based on the risk factor. So we ask people who heavily smoke, people who have asbestos exposure, or people who have family history of lung cancer to undergo screening procedures. And once you are diagnosed with lung cancer, that does not mean it's an absence of hope. We have various treatment strategies that work with patient and their families to fight the cancer and bring the patients back to the life that they want. So there are innovative surgeries, precision medicine, immunotherapy which has revolutionized cancer treatment, then personalized therapies, tobacco cessation therapies for treatment of lung cancer. So I hope I gave a little insight about lung cancer today. So if you are a person who are heavily smoking, or if you have family history of lung cancer, or if you have any symptoms suggestive of lung cancer, you can definitely consult a doctor and get a screening test done. And if you are a person who heavily smoke and who have an intention to quit smoking, you can definitely contact a doctor. Feel free to get in touch with us. So I wish you all of you a good health. Thank you. Take care.